Hey everybody, good morning, it's Rob Moffat. Guys, today we're going to be talking about treatment, a possible cure for paresthesia, which is numbness that happens after a dental procedure, which happened to me. And a couple days ago, actually, what was it, Wednesday, Thursday, I posted this video, My Delightful Dental Adventures, and I think I had 6 or 7 people unsubscribe. I look like I was dead in this video. I just went over my dental experience and my bad experiences with some dentists and talked about my problems I was having. But this one isn't about problems I'm having with dental, but it's possible solutions I'm having. What's going on is I have numbness now. It could be permanent, and I have to do another wisdom tooth extraction, and that could even make more permanent on the other side. And I did some research. There's not much they can do um, except wait. Um, there is some therapies, but it's kind of complicated. But I found something kind of interesting. I did some research, went to the National Library of Medicine, and they published this article from the Journal of Clinical and Experimental Dentistry. This is the government site, so it's not like Uncle Bud's medical information, but it is what it is, but it's still from the NIH and National Library of Medicine. And this is the abstract. It says oral paresthesia is a localized condition of sensory abnormality that occurs in the presence of injury in one of the nerves in the region after certain dental procedures. So what they did is they experimented with using lasers to give people back their sensation in their mouth, in their cheek, in their gums, and their chin after the surgery. Now, this particular laser therapy, they used a device I'll show you in a minute. It was at 808 plus or minus 10 nanometers, and it was 100 milliwatts, 3 joules or 3 watts, and 30 seconds per point, and they did it twice a week. And after 8 sessions, the patient reported total recovery of sensitivity in the chin, oral, and gum regions. And after 26 sessions, the patient reported recovery of sensitivity at all affected regions. Now, why did this happen? The literature points out 3 possible actions of low-intensity lasers in the treatment of paresthesia. One would be accelerated regeneration of the injured nerve tissue, which I can understand. Number 2, stimulation of adjacent or contralateral nerve tissues, which I kind of understand. Or 3, causing them to play the role of the injured nerve. I just messed this up. The reasons that they give is number 1, the literature says it could be accelerated regeneration of the injured nerve tissue, number 1, or stimulation of adjacent or contralateral nerve tissue, causing them to play the role of the injured nerve, which I kind of understand. And number 3, biomodulation of the nerve response to normality of the action potential threshold. I have no idea. I am not a doctor. I do not play one on YouTube. I don't know what that is. I don't know. But the first 2 I kind of understand. This is the patient. She had the same thing I did. Here's her wisdom teeth, and mine weren't touching, but they were touching the nerve right here. This is the nerve. You got to be careful right here and right here, running down. And when they take them out, sometimes it happens. I can remember going to Publix and just putting the bags of groceries over my wrist and going in the house, and later my hands were all numb and tingly because it pressed down on the nerve in my wrist. So imagine what removing the tooth that's over the nerve does. So that's why but sometimes it's permanent, sometimes it isn't. So it said after evaluation, it was concluded that it was a case of inferior alveolar nerve paresthesia after left lower third molar extraction, and thus treatment with low-intensity laser therapy twice a week with 72-hour interval between sessions was indicated. This was stating that they tried different treatments such as different chemicals and drugs, and there were no satisfactory results. So that's why they did this laser. Now, this is the laser they used right here. It's made by ECDMC. It's a Brazilian company, and It has 808 plus or minus 10 nanometers infrared. Actually, that would be near infrared because it's no longer infrared when it gets that high, I think. And 100 milliwatts, so on. Now, it says irradiation was always performed punctually. I don't think that means on time. I think that means something else. In direct contact with the region, in continuous mode, and with the laser beam perpendicular to the tissue. Here you can see the points where they did the therapy along the jaw and in the interior on the lip next to the gum and on the outside. This is exactly where my numbness is. It's right here and it's inside on the gum and it's right here. Not up here though. And this is the main place right here. And this is the device they use. And I did some research. They have these for sale, but they're quite expensive. They're like $2,500. And there are some consumer grade infrared devices, but I don't know if they have the same power. And I'm going to give you my recommendation in just a second. Now, you have to be very careful. The doctors and the technicians have to make sure you wear eye gear because the lasers can damage your eyes. Now, afterwards, it said based on the results, the patient was reevaluated 7, 24, and 30 days after, and there was no lack of sensitivity and complete satisfaction with therapy. They, in this paper, they go over some other studies that were done. This was a study by Santos. They used a little different wavelength, 780. It's still near infrared, and 90 seconds per point instead of 30, and 5 sessions at intervals from 3 to 4 weeks, where the earlier one was done like every 3 days or twice a week. It said significant improvement in patients with short post-operative period of 30 days and patients with persistent abnormalities in the late period from 6 months to 1 year. However, the first group of patients showed the best results. Therefore, the idea that time is of extreme importance and the patient's response is plausible, and that the dentist should indicate laser therapy as soon as he or she noticed or suspects sensorineural damage. In another study, Oliveira, they evaluated the effects of laser therapy. This one was 808 nanometers, and once again, 100 milliwatts and so on. 100 joules, 100 watts. 28 seconds duration per point, and the recovery of nerve sensitivity after minor oral surgery is observed that recovery was correlated with patient's age and interval between surgery and the start of laser therapy, concluding that infrared laser therapy can positively affect sensitivity after oral surgery. It says it's important to highlight that the major advantages of laser therapy in these types of cases are absence of side effects, that's totally non-invasive and painless treatment, and most patients show significant improvements. In addition, laser therapy can be used alone or in combination with other treatments and be safely performed by trained professionals. They're not recommending you go to eBay or Amazon and buy your own. Within the parameters used, laser therapy was effective in the treatment of inferior alveolar nerve paresthesia due to third molar extraction. In addition, laser therapy was well accepted by patients and proved to be a painless, non-invasive alternative with no side effects. The acknowledgments were there was no funding declared and there were no conflicts of interest, and so on. These are the references. If you're wanting to learn more, these are different studies and so on that have been published on this subject. Now, what am I recommending? I'm recommending you go talk to your dentist, you go talk to your doctor, print this out. I'll leave a link to it. You can print it out and show it to them. I'll tell you what happened when I did. I didn't show this to my dentist, I should have, but I talked to him about it, and he said, well, he's looked at the literature, and not this literature, but whatever he has, whatever he believes in, he looked into it, and it said it doesn't work. And he also said that the reason he doesn't think it works is because it just, the lasers just, they don't go into the skin. They don't go past the skin, so they don't go very deep. So he's saying it can't help the nerve if it's not going deep. And I understand, like most lasers, they go like 3 or 4 centimeters at the most, which is like less than a 1/16 of an inch. But I think the near infrared light, it might go deeper. And that's what's happening here. They're using the near infrared light. So I would talk to your dentist or your doctor and somebody else and see what this, and see if you can find out more information about what's available in your area for a laser treatment. This was something I had no idea existed. Nobody told me. Everybody was just basically saying, well, you got to wait it out and see what happens. And so, you know what? I'm not a wait it out kind of guy. I mean, I got a problem. Uh, I want to find a solution, and I don't want to have this the rest of my life. So let's look into this. I'm going to look into some of the other consumer grade ones and talk to my healthcare professionals and see what happens with that. And I don't know. I'll be letting you guys know what's going on with me. But I don't recommend you go do stuff yourself. You want to talk to your dentist, your doctor, your healthcare professional. But use this as a starting point to learn more about this subject and see what you think and other people that you respect in this area and see what they have to say. So I thought this might be helpful to some people out there who are having trouble with numbness due to a problem from dental extractions of teeth. And like I said, the ones that are out there, they're pretty expensive. But they have some consumer grade ones I'm looking into that might be interesting. I can't say anymore. So guys, good luck to you. Hope no more people unsubscribe. my friend, my friend Buck from Chef Buck, he said every time someone unsubscribes, another angel gets his wings. So I had a lot of angels get their wings last week. So guys, hope it was helpful. Hope you continue watching. I put on new videos every week. Been doing it for 16 years. Got over 1,300 videos on many different subjects because it's a variety channel. It's a variety channel. A variety channel means I put on something one week, you like it next week, you see something that makes you want to unsubscribe. So that's what a variety channel is. All right, guys, I'm rambling here, but I'm still here. You can't get rid of me this easy. So, all right, take care. See you out there.